Well, generally as I'm setting the intensity level, I set it as high as the horse is comfortable. Once I get to a point where a horse is starting to move away from it a little bit, we'll turn the intensity back down. The intent, I found out that these horses don't take as high a frequency as a human does. So if you're using it on yourself, you'll probably turn it up a lot higher for yourself than you will on a horse. The muscle movement that you're seeing is actually a stimulation of the nerves causing the muscle to react. The horse isn't feeling any pain, he's comfortable. TEMS machine actually is a nerve block. It will stop the pain signal from wherever the horse hurts. It will block the nerve pain signal to his brain. The horse will not get better, he will not feel the pain. The pulse electromagnetic therapy actually heals at the cellular level and not only blocks the pain, it starts the healing process at the same time.
So there's no electricity going into that horse from that cable?
There is no electricity going into the horse from the cable. The electricity is actually delivered to the cell through a magnetic field, and as that magnetic field decays, it releases the energy throughout the cell.
Would you say that's too strong?
No, I think he's fine. He's young and he's playing. If you can see, he's relaxed. He's got his head down. He's kind of turning a little bit into it. He likes the way it feels. He's not in any way trying to pull away from me. And if you can see where he's got good neck muscles, he's relaxed. But you can see he's fairly tight through here also, okay? Now as he ties down here in the shoulder, fairly tight. And after therapy, I want to show you the difference of how loose this horse will become here in his neck muscles on both sides. Even as you see when he straightens up, I mean, he's just as loose and flexible as he can be right on down his neck muscle. This therapy really seems to help as far as releasing attachments in their muscles. And from what I'm seeing, it does a lot in the same effect as a myofascial release as far as the muscle adhesions releasing and relaxing in horses' muscles where there's been trauma. We've been seeing, as doing this, the greater range of motion. These horses get a lot cleaner in the front end. A lot of them that are a little heavy in the front end, it'll clean them up. And like I say, this seems to be our problem area through here and down here from about C3 area down the neck and into the shoulder. I'm going to change now, and we're going to go to the big sun loop, and I'm going to show you how we work.
Hey Bobby, I got a question.
Yes, sir.
Before we move. If a client called you for therapy on this horse and said, you know what, I really want you to, this is the issue, would you spend 45 minutes on the neck?
I probably wouldn't spend 45 minutes on the neck on a client calling on an issue. If their veterinarian had said, this animal has a problem right here, yes, I would spend more time here, but it wouldn't be in just one spot. It would still be the whole horse approach, but I would spend a little more time, as I'll show you with the big sun loop, and then I'll use this one around his neck. There's 3 or 4 different ways to really work this neck area other than just laying it on top of his neck.
So would you work on that horse until you physically felt change, or is there some signal or sign that the horse is going to give you, hey, I've had enough, it's done?
Most of the time, a horse will tell you when he's had enough. It'd be very interesting to watch. A lot of times a horse will really release by yawning very big. They'll lick their lips a lot, but a lot of times they'll have a little different look when they do it. And you can tell that the problem has been released, and they have whatever problem's there, they've gotten some relief from it. That's usually when I quit. If I go much farther, they seem to get impatient and try to move away from me a lot more.
So that intensity setting, that's probably low to moderate?
This is actually a very, very low intensity setting. If we were spending the normal time on this horse, it would probably be a little higher. But once again, you'll see the difference in this muscle from where it was just a few minutes ago. We don't want, especially a horse that's fixing to be shown, you don't want to overdo him. They can get a little bit muscle sore. So be a little careful that you don't just stay on and on and on. A horse that's not being shown may be a little bit muscle sore tomorrow and maybe the following day, but they clear right up after that, and it's not any different than if you had gone out and exercised a little too hard when you shouldn't have. It doesn't, there will be no permanent pain or problem from this therapy.
How would you adjust the intensity with his reaction?
Well, what I would do is if I feel like he's a little sore here, I would turn it down and treat this spot. So I would turn the frequency down 4 to 6 minutes here. Okay. But in the whole body therapy, I'm going to do that anyway. If I just had a few minutes to work on him, he was fixing to go show, and I'll show you in just a minute how to look for hot spots. But in a short time, if you can find a hot spot and treat that, that's what you need to do before you go show.
What does the hot spot really show, though? The
hot spot really won't show you anything other than a reaction from the horse. And it may be even so much as he's standing here comfortably and he pins his ears and swings his head at me, to he steps away, and it's just a reaction from the horse. There's not anything that's going to happen in this area that's going to show you that there's a hot spot. It'll be just the overall demeanor of the horse and the way the horse moves and reacts to you. Huh?
Yeah, give us the definition of what a hot spot really is.
Well, a hot spot, these horses are going to have, just like humans, they're going to have things that hurt them. And these horses, these performance horses, there's so many spots back here in their lower back and pelvic area that you can have a problem. It could be anywhere along this back, through the glutes, anywhere back here. And what this is you're trying to find the spot that's really causing the problem. Now you got to be a little careful though, because back pain here can lead to back pain here. And so you need to find the cause of the problem and treat that, and not just the hot spot. Okay? So everything leads to something else.
Yeah, that's why you need to do the whole body approach versus just area specific or injury specific.
That's correct. If a veterinarian tells you that this is what's wrong with the horse and this is what needs to be treated, that's what you need to treat. I mean, among other things, still do the whole body. But if you're just going out here and working on a horse and you just know the horse is a little off, you need to treat the whole body, find you maybe a hot spot or two, treat that a little more. For those of y'all who know gait analysis, I recommend watching your horses, seeing how they move, seeing if they're a little short here, if they're a little off here. We do a lot of palpation on these horses, and a lot of times the palpation without this machine, the only way to find the bad spot is through palpation. This program really helps you find it without having to be quite as knowledgeable as you would should you have to go through the gait analysis and the palpation. Okay, the hot spot really helps you.
Have you ever seen this light up or find the origin of the issue where a vet or a professional has a hard time finding it?
The times that I've had problems with other people on the horses, and it's 100% due to the reading out of the pulse electromagnetic therapy. It's not something that I could find or that makes me as smart of or know anything like a veterinarian or someone else. It's the reading you get. I've had readings looking for hot spots on shoulders to where a horse could barely stand any pressure here. You go around the other side, it was the same way. And so my original thinking was that horse is just a little sensitive there. But in looking a little further, what had happened was in a horse has 7 cervical vertebrae. Number 7's deep down in here. So when you get a chiropractic adjustment, where there's some very, very good chiropractors out there, lots of them miss the C7 adjustment. You know, they can't, it's down in here, it's hard to find. And this has picked up a horse being out in C7 on numerous occasions for me. Okay, we find some, you know, some deeper problems down in the glute area, but very rarely. Mostly it's been things that through other therapies it's hard to find, and it came from the reading. It didn't, you know, it came from just the reading of the machine.